for being here today. This is an important day. It's a day where the community is coming together to share an important message about options that are available for those who maybe find themselves in a situation where they need to make a loving and courageous choice for their newborn child. And there's an appropriate way to do that. And again, collectively as a community, we want the community to understand what that is and that there is there's support and there are options. And with us today, we have our friends and colleagues from Trios and Lourdes. We have their Director of Communication. We have their two Chief Nursing Officers here and the Director of the Emergency Department from Lourdes. We also have Tom Huntington from Richland Fire, and we also have our friends from many of the local fire districts, and Mike Van Beek will be able to better speak to that. But I want to turn it over now to Marissa Miller. Marissa is the Assistant Manager for the Emergency Department at Kadlec. And after Marissa speaks, you will hear from Mike Van Beek, who is a Battalion Chief with Richland Fire. So Marissa.
Thanks, Emily. We as a community of healthcare providers and first responders want you to know that there's a safe and legal option for you to surrender your baby if you're in that situation. We know that even a planned pregnancy is very scary and a lot of work. And if you find yourself in a devastating situation where you're unable to safely care for your baby or provide for them, that there are options to safely surrender within 72 hours. As long as your baby is unharmed, this can be done anonymously and without prosecution or criminal liability. An infant is most vulnerable within the first few hours of life, and it is critical that they receive the medical care that they need. The Washington State Safe Haven Law allows you to surrender your baby to any open emergency department, fire station, or federally designated rural healthcare clinics. If you change your mind after surrender, there is a process in place to help you get in touch with your baby's assigned social worker. We know this is a very difficult decision that you may have to make, but it is also a very courageous one, and we are here to support you in making that decision.
My name is Michael Van Beek, Battalion Chief of EMS for Richland Fire and Emergency Services. I wanted to say thank you to Kadlec for spearheading this media event and allowing us as fire and EMS agencies to partner with them to get this important message out. I also want to thank our other hospitals, Trios and Lourdes, for being here, and a special thank you to all the fire and EMS agencies that made it out for this event today. The birth of a child is one of the world's most beautiful times. It is a time of love, joy, and celebration. The birth of a child can also be overwhelming and incredibly difficult. We want people to know that there are options if you cannot care for your newborn baby. Within 72 hours of an infant's birth, you can leave an infant at any hospital or fire station without fear of prosecution and anonymity. An infant is most vulnerable within the first few hours of life, so it is critical that infants receive any medical care needed. Bringing your newborn to a fire station or the emergency department is a courageous decision. Since 2009, 59 babies have been brought to safe haven locations in Washington State. We want the community to know that this option exists for them. Our mission statement at Richland Fire and Emergency Services is to protect and enhance the quality of life. The Safe Haven Law fits lockstep with who we are as firefighters and EMS providers. You can bring your newborn to any safe haven location with no questions asked. If you bring your newborn to a safe haven location, please be sure to give the baby to someone. Please do not drop the newborn off at the door and leave, but physically give them to a firefighter or healthcare provider. From there, the newborn will be brought to the emergency department for evaluation and given any medical treatment needed. Again, we understand this is a difficult decision, but it is a courageous one. And we as firefighters and healthcare providers are here to help. Thank you.